Wednesday morning, the Minister of Education, Nigel Carty, issued a statement pointing fingers at dermatologist Dr. Thelma Philip-Brown, accusing her of collaborating with some teachers to plan a strike. Wednesday afternoon, Dr. Brown responded, insisting that she had no agenda beyond ensuring that the campus environment was safe.
I saw a child recently who had actually what we'd call a chemical burn both sides of her eyes. Whatever was irritating her eyes, she was rubbing it so much that it burned all the sides, both sides of her eyes, and on the right eyelid. And I didn't even write anything about that. All I wrote was a note to the teacher that she wouldn't sweep because she also gets a problem when she's sweeping. That's all I wrote. When I gave the letter to the mother, she looked at it and she said, "I hope nothing in here to make them get angry." And the child said, "So what if they get angry?" And I almost cried because I realized that we are so politicized that the children are suffering. And our first thought, even as parents, is offending somebody else.
Dr. Brown believes that her call to have a team from Kariri brought back to St. Kitts to conduct follow-up tests as they had recommended is not being taken seriously because of her affiliation with an opposition party. Do you have an agenda? Are you making these statements for political gain or political mileage?
I'm not running anywhere. In terms of talking frankly, what I see and the concerns I've done it for almost 30 years in this country, whoever government is in power. I've spoken when Pam was there, I've seen an issue, I've spoken against it, and the same here. I help this Labour government to get in. If I'm talking now, it's because I think something is wrong.
In a statement issued Wednesday, Minister of Education Nigel Carty levelled accusations at Dr. Philip-Brown, suggesting that with the facilitation of the president of the St. Kitts Teachers Union, she's trying to encourage teachers at the Bassetere High School to go on strike. Minister Carty says that at a meeting Tuesday held at the offices of the Teachers Union President, Mr. Ron Collins, Dr. Philip-Brown set out to scare the teachers who were present by telling them that the school was contaminated. Her conclusions, he says, are baseless, erroneous and deliberate and contrary to the findings of Kariri. Dr. Philip-Brown denies that she has ever been asked by the ministry to provide information about her patients to the Ministry of Health, as Minister Carty said in his statement on Wednesday.
I started seeing students complaining of different issues, students and teachers. Shortly after the school reopened, I waited until November just to be sure. I spoke to the headmistress to ensure that really there were issues, that there were symptoms, that this was not just psychological. I wrote to the permanent secretary in the Ministry of Education. I copied several persons, including Ministry of Health, CMO, Teachers Union, etc., and the other members on the committee. I have not had a response from anyone, so I'm not sure who said that I should provide information because I was not told that.
She dismissed the assertion by Minister Carty that she was due to speak at a PTA meeting on Wednesday with the aim of eliciting a desired result.
I really don't wish to get into any back and forth with the minister. I noticed he said that Kariri said this school was free of, or something to that effect, of contamination. So I will encourage him to make the report public so everyone can see for themselves whether that is the truth or not.
Wednesday afternoon, the president of the St. Kitts Teachers Union, Ron Collins, also responded to the minister's statement Wednesday.
There are a number of teachers who have reported to the Teachers Union that they are experiencing the same vertigo, dizziness, the rashes, various breakout in their face, the itching, and the list goes on. The same areas of ailments that were being experienced before. What we did as a union, because we know that this is a very politically charged environment, and so as a union, we wrote to the Minister of Education several weeks ago requesting audience so that we can properly address and we ask critical questions to ensure that everything was good at Bassetere High. But the areas of illness have grown. In fact, last week, I again was bombarded with reports from teachers. The teachers union at the executive level has addressed this. They recommended that we write to the minister, which we did. He has not to date even acknowledged receipt of the correspondence.
Mr. Collins, who is also a guidance counsellor at Bassetere High, defended Dr. Brown's attendance at the meeting on Tuesday, saying that she had been asked to serve as the union's medical advisor while the air quality issues at the school were being dealt with. Responding to the minister's claim that a number of teachers have reported that they're being pressured into facilitating a strike, Mr. Collins categorically denied that teachers were planning industrial action.